Health officials could soon face a fresh challenge, talking vaccinated people into getting booster shots to gain longer-lasting protection as the Delta variant sends infections soaring again. As early as this week, U.S. health authorities are expected to recommend an extra dose of the vaccine for all Americans 8 months after they get their second shot, according to 2 people who spoke to the Associated Press on condition of anonymity to discuss internal deliberations. That means the biggest vaccination drive in U.S. history is about to get even more extensive. The move is being driven by both the highly contagious variant and preliminary evidence that the vaccine's protective effect starts dropping within months. The new urgency from U.S. officials reflects how quickly the variant has knocked the country back on its heels. On July 4, President Joe Biden proclaimed that the nation was declaring its independence from the virus. But since then, infections, hospitalizations and deaths have increased nationwide, overloading emergency rooms across parts of the South and West. When Pfizer announced plans in July to apply for approval for boosters, U.S. officials shot back that it was too early to know whether they were needed. Experts worried that a new campaign calling for boosters would muddle the continuing campaign to win over the tens of millions of Americans who are skeptical or hesitant to get their first shots. We have to really make sure that while we're spending a lot of time and effort on third doses that we don't undermine our campaign for first vaccinations, Lawrence Gostin, a public health specialist at Georgetown University, said Tuesday. That's truly the existential crisis in the United States. Calling for third doses could discourage people who had been skeptical of the shot's effectiveness in the first place, Gostin warned. Booster shots would only begin to be administered widely once the Food and Drug Administration formally approves the vaccines, which are being dispensed for now under what is known as emergency use authorization. Full approval of the Pfizer shot is expected in the coming weeks. Last week, U.S. health officials recommended boosters for some people with weakened immune systems, such as cancer patients and organ transplant recipients. The director of the National Institutes of Health, Dr. Francis Collins, said Sunday the U.S. could decide in the next couple of weeks whether to offer booster shots this fall to other Americans as well. Among the first to receive them could be healthcare workers, nursing home residents and other older Americans, who were some of the first to be vaccinated once the shots were authorized last December. More than 198 million Americans have received at least one dose of a COVID-19 vaccine, or 70% of those who are eligible, according to the Centers for Disease Control and Prevention. Just under 60% of Americans 12 and older are fully vaccinated.